Hello and welcome everybody, and welcome again to Dr. Adil Sheraz. This must be our third session this year alone.
I think so, yeah.
Yeah, well, it's always a pleasure to see you, and thank you very much.
No, thank you for having me.
And so today, I must put in that obviously this is in collaboration with the Great British Skin Foundation, who have always been great, well, hopefully we're mutual supporters of each other. And British Skin Foundation are based around research for skin conditions. And I think they've got the most fabulous website. It's just full of all skin conditions. And when you start looking at skin conditions, there's I don't know how many there are, but there's a lot of them, aren't there? So I think it's a really great place. And what I like about the British Skin Foundation is I found them, they are very, very neutral based. There's no veering one way or the other. It's totally impartial, and it's all about researching and trying to support patients, which is quite unusual for a research charity to be so supportive of patients, which I think is fab. So moving on, today we're going to be talking about skin cancer. And I know, over the years, we talk about skin cancer so much more, but it's really interesting, I think, as to whether people really take on board what it really means and what they should be doing. And it's not just that, well, I'm on holiday, it is that daily awareness of being out in the environment. So today, as with all of Adil's webinars, or the British Skin Foundation webinars, is that we ask our members for questions before. So we're very happy to take questions while we're going along, which we'll answer at the end. But we do these questions more as a Q&A session rather than a general chat. But having said that, Adil's had a look at some of the questions, and I think that we've agreed that what would be really we want to do is to give people an overview of what skin cancer is and the various different types of skin cancer, so that we've got a good base. So Adil, would you please just do a quick introduction of yourself? I know it's not needed, but just for people, if they haven't caught any of your other great webinars, please do an introduction, and then we'll kick on with the different types of skin cancer.
Sure, right. So thank you so much, everybody, for joining and listening. Thank you to talkhealth and British Skin Foundation. So my name is Adil Sheraz. I'm a consultant dermatologist. I'm based in London. I have various skin interests, including skin cancer, which is what I will be talking about today. So if we start off with the types of skin cancer, or maybe even before that, what is a skin cancer? So a skin cancer is essentially an abnormality in a part of your skin whereby there is uncontrolled growth of certain cells that shouldn't be there. And this is true for any cancer, whether it's lung, whether it's liver, kidneys. There's an uncontrollable growth of cells that shouldn't be there. The body is unable to stop this growth. And that is the same case for skin cancers. Now, there are essentially, when we look at skin cancers, we divide them into two types. So you have a melanoma skin cancer and a non-melanoma skin cancer. Now, your melanoma skin cancer, which by far is the more deadly type of skin cancer, generally will present as either a mole that has changed or maybe a new mole. So they're usually your standard moles that you've got on your body, the dark pigmented spots, the moles that change, or a new one. Your non-melanoma skin cancers then are divided into two types of a basal cell cancer and a squamous cell cancer. All cancers, or all skin cancers at least, are related to excessive sun exposure, which we'll come into in a bit. Now, your non-melanoma skin cancers, so the basal or the squamous cell carcinomas, are not as deadly as the melanomas. They're a lot more common, however. So basal cell carcinomas, for example, are the commonest cancer in humans. And by far, skin cancers, particularly melanoma, is the fifth most common cancer in the UK. Now, it's important that you examine your skin and recognize whether you have a cancer or a changing lesions, and get your doctor or GP to have a look at these. Did you have any questions about that, Katrina? Did that make sense to you, or do you think we need to elaborate a bit more?
No, I think that's kind of fine. And I think the major thing is that you actually said about it is that you don't actually have to understand cancers. I think there's so much around. It's like, oh my God, should I recognize whether this is a cancer myself or not? It's actually, if you're concerned, just go to your doctor, really, isn't it?
Yeah, absolutely.
Are all doctors trained specific? Can all doctors, GPs, know about skin cancers, do you think?
Well, I think so. Of course, dermatologists are in the best position to be able to diagnose your potential cancer or tell you that it's harmless. GPs, there are specific GPs who have specific training in dermatology who are definitely able to do it. On the whole, a GP will be able to most often recognize that something isn't quite right. So they may not be able to tell you that this is a cancer, but with experience, they will be able to tell you that this lesion or this mole or this lump doesn't look right and you need to be seen by a dermatologist. So it's definitely worth seeing your GP if you're not sure.
And I think we've got a question further on here. So I'll kick on with the questions unless there's anything else that you wanted to...
No, that's fine. We can start with questions. I'm sure we'll go through the other bits and pieces.
We've got two questions, which two from me, which I put mine at the top of the pile, because they're slightly different. When I was reading up on it, the NHS said that more men than women were affected by skin cancer. And I was thinking, why would that be? Because, my experience is that women are the ones, I mean, this is probably completely incorrect, but women are, as out of my friends, we're the ones that are out there sunbathing and the men are under the umbrellas. So
that is true. Men do have a slightly higher risk of getting skin cancers. And I think a lot of the reason behind that is probably to do with habits. So men generally tend to use less sun protection on the whole. They also are less observant with regards to their skin. They may go to the GP less with skin issues or with changing mold. Men also tend to get, most of the melanomas in men are generally on their torso and a lot of them on the back. So it's an area you can't see. Whereas women tend to get more melanomas on their legs. So you will be able to see a changing mole on your leg and you may be able to get it removed before it turns into a melanoma. Whereas on the back, of course, you can't see it. And it's often quite late before you realize that something is abnormal there. So that may be another reason. But the other factor is that men may have more jobs where they're working outside, manual work or labor work. I used to see a lot of my patients who were from in their sort of 70s and 80s who had been in wars or served abroad in the Middle East. Men also go bald a lot quicker. Women tend not to lose their hair as much. And a lot of the non-melanoma skin cancers, so for example, the basal cell cancers, generally, most of them are on the face or on the head and the neck. So men tend to obviously lose their hair and they're not protecting as much. So they may develop more cancers in these areas for these reasons.
Okay, fine. The other thing is that, and we speak to a lot of people about these apps that you can now get, where I think you scan your your mole, and then they say yes, this is a baddie, or no, this is fine. What do you feel about those? Do you think they're safe, or?
I think AI has come a long way over the last few years, and it probably is going to be the future. In terms of aiding dermatologists in making diagnoses. I think that's something that we all recognize and we should all embrace that. Where it stands currently, it may not be quite as good, but there are some programs out there that are very accurate in diagnosing skin cancers. In terms of what patients have availability, what they have access to, or what consumers have access to, are various apps where they will take a picture and then they may take a picture a few months down the line. I think these apps are good, and I think they are good in the way that they'll be able to tell you if there's a specific change or if a mole looks slightly odd, and it just gives you that slight push maybe to go and see your GP. I think that's how you should use it rather than as a diagnostic tool, because your dermatologist or your GP will be probably more accurate than the apps you are able to get on your phone. So use it more as a monitoring tool. Something looks dodgy, looks abnormal. It just gives you that push. Maybe I should go to the GP and get this looked at.
Okay. Actually, one thing that may be worth just quickly saying is what when you mentioned something looks dodgy.
Yeah.
What is dodgy and what's okay?
Good question. I think in terms of, so there, when I said there are two types of skin cancers, melanoma, non-melanoma. So melanomas are generally, on the whole, not always, but generally they're moles. So they're dark spots, which everybody may have, but there are moles that might have changed, or it might be a mole that is new. So when I say change, what I mean is the size may have changed, the color may have changed, the symmetry may have changed. So the four things we tend to look for any moles or melanomas are, if we break it down, the ABCD rule. So A for asymmetry. So if you put a line down the mole, do the two sides look the same or do they look different? So if they look different, the mole is asymmetrical. B is for border. So does the border look nice and smooth, or does it look quite jagged, irregular? Does it have a notch in it somewhere? So look at the border. C is for color. Does it have lots of different colors? So if it's a dark mole, but it's all sort of brown throughout and equally brown, that's usually a reasonably good sign. But if you have patchiness throughout the mole, a dark spot one end, a blue spot one end, a gray spot or a white spot, those are not good signs. So C for color and D for diameter. And the general thinking with diameter is if your mole is getting bigger, then get it looked at. So those are the four things you want to look at in terms of potential melanomas or abnormal moles. But then you've got the other side, the non-melanoma skin cancers. And these are not moles or freckles. These can be growths on your skin. So they might look like, so basal cell carcinomas, which is the most common cancer in humans, often looks like an area that is slightly shiny, slightly raised. And most people will come to us and say, oh, I've had this spot that hasn't gone away for the last 3 months. And that's typical. They'll say, oh, it bleeds and then it scabs, then it bleeds and then it scabs. If you've got a spot on your body that has not healed for more than 4 weeks, it needs to be looked at. Your body should be able to repair something in it within a few weeks. And if it isn't repairing it, it's because there's something wrong. So I always used to get, very commonly I would get patients, slightly older patients who would come in and say, oh, I was gardening. I had a thorn injury from the rose bush and it just hasn't healed and it's been 6 months. That's not a thorn injury, that's something else. So you need to get it looked at. So basal cell often looks like a non-healing ulcer or a non-healing lesion or a raised shiny lesion. And then the squamous cell carcinomas are usually lumps on your skin that grow very rapidly. So they almost appear like raised tumors. And sometimes they are described like as volcanoes, where they almost erupt like a volcano very quickly, either on the hands or the top of the scalp. So anything rapidly growing, anything non-healing, or a changing mole needs to be looked at.
Right. Oh, no, that was very simple to understand. Thank you. Because you do look at things and you think, oh, have I had that there before or not? Isn't it? Because quite often you notice something. Right, let's just go through some of the questions we've got. In the past 4 years, I've developed a lot of, I couldn't do that word. Was it
angiomas?
Angiomas, red moles on most of my trunk. I'm a female, 63, and had the skin cancer removed just before COVID, but the results were lost. Should I be concerned or ignore? There's no pain. Also, I was diagnosed with a lot of skin damage.
Okay, so a few things going on there. So first of all, angiomas, which are red lesions on the body, they are harmless generally. They are a collection of blood vessels. They are not moles. So they almost never turn into cancers. And on the whole, if we see them as dermatologists, we tend to leave them alone unless they're bleeding or causing a symptom, and we may then remove them. So angiomas are a collection of blood vessels. They are not moles. You can leave them alone. But of course, you need to get somebody to look at them to confirm that they are indeed angiomas. And they do appear like red spots on the skin. In terms of the other part of the question, where there was a skin cancer removed in the past, but the results are not known. So I guess the first question would be, how do you know it's a skin cancer if the results were lost? What type of skin cancer was it? Does it need follow-up? I think there's too many unknowns there really to answer that question. So it's a bit tricky with that one, but maybe you should go back to your GP or your dermatologist and ask them to do a skin check just to make sure there's nothing else going on the skin. And by skin damage, I think that probably refers to sun damage, I'm assuming. So if you've got a lot of background sun damage, i.e. you've been in the sun a lot, and if you've got background sun damage, then yes, the risk of skin cancers goes up. So it might be a reason, again, for you to get a check done by your GP or dermatologist.
Thank you. Are you more likely to get skin cancer as you get older?
Yes, you are. And the reason for that is, number one, cumulative sun exposure over the years. So we know that the sun plays a big role in all skin cancers. And the more you have of it, the more likely you'll get skin cancers. The longer you live, the longer you've had sun exposure, therefore the risk of cancer goes up. We're also living a lot longer, and as with any other cancer, the rates go up as you get older, because the body's repair mechanism essentially isn't quite functioning as well as it would have. So your risk of skin cancer gets more as you get older, partly because of repair issues and partly because you're just living longer and you've had more sun.
Oh, here's a good one. Sunbeds. Are sunbeds safer as opposed to the old days? And do you think they're safe to use at all, e.g. in preparation for going on sun holidays so you don't burn to start with? Because I think a lot of people, well, I don't know, I imagine people go on sunbeds before they go on holiday.
So we get, so the base tan. So, a lot of people say, can I get a base tan? And then it prevents from burning. So the WHO, World Health Organization, classified sunbeds as carcinogenic devices many years ago.
Yeah, sounds horrendous.
So what is a carcinogen? A carcinogen is something that causes cancer, is known to cause cancer. So tobacco is a carcinogen, arsenic is a carcinogen, radioactive material are carcinogens, and sunbeds or tanning devices are in the same category. They're carcinogens. In Australia, in Brazil, and a few other states in America, they've been banned, outright banned. So you can't use a sunbed in Australia. The point I'm trying to make is that no sunbed is safe. So you should not be using sunbed. And a lot of patients will then come back to me and say, what about vitamin D production? And I'm using it partly to get vitamin D as well. I think that's slightly, I think the sunbed companies throw that out, but I don't think it's accurate. And I know people have businesses to run, so I understand that side of things as well. But when you're under a sunbed, you're essentially receiving UVA radiation. So remember, the sun produces UVA and UVB. UVB generally causes us to burn and go red, and UVB is also mostly responsible for skin cancers. UVA causes the tanning effect. It also causes skin aging. It doesn't burn us like UVB does, but it also contributes to skin cancers. And we know it does from recent evidence that UVA also contributes to skin cancers. Vitamin D production is because of UVB. So when you're under a tanning bed, the fact that they say that you're getting vitamin D is not correct, because mostly what you're getting is UVA, and UVA doesn't really role in vitamin D production. So you can throw that out the window. Vitamin D production's got nothing to do with your tanning on the bed. Having a base tan. So first of all, I need to say that no tan is safe. Every time your skin is tanning, there is DNA damage that is occurring in your body. The reason you tan is because your body is trying to protect itself from the sun. Every time you tan, there's DNA damage. Most of the time, that DNA damage will be repaired by your body. And it's occurring all the time. Every day, multiple DNA cells in our body are being damaged, they're being repaired, they're being damaged, they're being repaired. And at some point, what will happen is your body will not be able to repair that, and that's when you will develop a skin cancer. We also know that people who use sunbeds before the age of 35 have roughly an 80% increased risk of getting a melanoma. Wow. And that's out there in the papers and the research. Yeah. There is no question at all that, there's absolutely no doubt that UV radiation from sunbeds is linked to skin cancers. There's no evidence that goes against that claim. Yeah. So I would suggest that you don't use a sunbed. There's no such thing as a safe tan. You're better off avoiding the sun and maybe getting if you want to go in the sun, do it safely, do it responsibly, do it at the right times of the day, avoiding those times between 11 and 3, and make sure you're protected. And purely from a cosmetic point of view as well, it will prevent photoaging, it'll prevent wrinkling, it'll prevent pigmentation on the skin. So you will generally look a lot younger as you get older if you protect yourself from the sun from a cosmetic point of view as well.
If you never went in the sun, would you have no wrinkles on your face? That's me pointing to my face, yeah. Which does have wrinkles, but you'd still have wrinkles because you're dehydrating, isn't it? Because
you will get wrinkles.
Yeah.
That's a natural aging process related to collagen production in your skin. And collagen production as you get older becomes less and less. In fact, it starts degrading after you pass your 20s or so, I'd imagine. So that's when the collagen production starts to reduce in your skin. So you will get wrinkles as you get older, unfortunately, regardless of the skin. But the skin increases the breakdown of collagen, so you will get more wrinkles. And if you want to know what your skin would look like without sun exposure, you can have a look at your bottom if you can see it, because the skin at the bottom is usually quite smooth, it's not quite pigmented, it's not that wrinkly generally. So that's what your skin would have looked like if you didn't have sun exposure generally.
Wow. I won't say any more. Right. Do you believe that long-lasting sun creams work? Yeah. Do you believe long-lasting sun creams work, especially on children when they're in and out of water? Because I know with children, it's such a blah, isn't it, putting it on? And so, these ones that last 24 hours, whatever they say, if you think, oh, I've just done it once, that's it, I don't need to go through that rigmarole again.
So the guidance on sun creams and sun protection, and most of the studies that are done on sun creams are done based on the fact if they are applied every couple of hours, every 2 hours. So when a sun cream says it's SPF 30 or SPF 50, then it is based on the fact that it's being applied regularly. It will then give you that protection that it states. So there is no sun cream that will last 24 hours, in my opinion. If you're going in the water, you almost definitely have to reapply it. No question, it will come off. It will be wiped off. There are some sun creams that are water resistant. But what tends to happen is you go in the pool or the sea, you come out, you dry yourself off with the towel, and you've taken off the sun cream with the towel. So you need to reapply every couple of hours if you're in the sun, because you will sweat as well, and that will also reduce the effects of any sun protection. So every 2 hours, it needs to be reapplied. There is no 24-hour protection sun cream.
Right. And also, I mean, I don't know if it's probably, I imagine it's the same with eczema and psoriasis. Whenever we run trials, getting people to apply a product, whatever it is, we always issue instructions of how much you put on, because people generally never put enough of a cream on, do they? No.
So you're absolutely right. So I think I did a blog for the British Skin Foundation on sunscreens, and it's probably still on their website, where I talk about exact amounts, how much to apply, where to apply, how often to apply, what types of sun creams. So you could have a read of that and go through all of the various bits and pieces of how you can apply sunscreen and which ones to use, etc. So yes, you need to apply enough to cover the right areas. Also, pay attention to specific areas which are almost always missed. So the tops of the ears are usually missed. Lips, people tend to forget about the lips. Eyelids, if you're closing your eyes, you're under the sun, then eyelids are often missed. You need to get eyelids. The feet are usually missed. And remember, don't forget the soles. You can get cancers on the soles of your feet as well. So you need to apply sun cream there. If you're going to be on the beach with sun exposure on the soles, you need to protect the soles as well.
Oh, that's really, because I was just going to say to you, and where do you apply it? So that's really interesting. My partner has patches on his head. I think this is actin keratosis. He had it checked out years ago by the doctor, who said it's fine, keep wearing a cap and sun cream. I've noticed over the last few months there seem to be more patches. Should he go and see his doctor again, and how regularly should he have it checked out?
Okay, so if you've got actinic keratoses are the result of sun damage or excessive sun exposure. It's very common in men, present on the top of the head, on the ears, because of balding. And it is a sign that you've had a lot of sun exposure over the years, and actinic keratosis in themselves are precancerous. So Almost always actinic keratosis are treated. We tend not to leave them unless there's a very good reason to leave them. I mean, if you're 99, then you may not want to treat your actinic keratosis. But if you're 50, 60, 70, even a healthy 80, we would suggest that you do treat your actinic keratosis. The more you have, the higher chance that one of these will develop into a skin cancer known as a squamous cell carcinoma. Squamous cell carcinomas can spread. They can spread to your lymph nodes. So you do need to get actinic keratosis treated early to prevent conversion to a squamous cell carcinoma. So see your GP. And there are lots of treatments available. You can freeze them. There are creams. There are specific light treatments that we use. So lots of treatments are available, but you need to see your GP to get them diagnosed and then get the right treatment.
Because you do see, I mean, it's so common, isn't it? In older men with no hair, they all seem to have big brown.
Oh yeah, it's one of the most commonest things we see in our clinics.
Yeah.
And again, very common on the top of the head and the ears, top of the nose, back of the hands, very common areas. And as I said, we almost always treat them. There's also some recent evidence to suggest that if you take nicotinamide, which is a B vitamin, so taking nicotinamide on a daily basis may well reduce your risk of skin cancers by 20% if you have actinic keratosis. So it's worth taking a supplement of nicotinamide. You can just buy it over the counter. It's also called niacinamide. So you can take it orally over the counter. And it's pretty safe to take. There's hardly any side effects. So you can take that if you have multiple actinic keratosis. Taking that will reduce your skin cancer risk.
Gosh, that's really good to know, because I'm sure that most of those men do not go and get their head checked out.
No, it's usually the wives that push them into it. On the whole, and then we'll come across the actinic keratosis. And remember, if you've got actinic keratosis, it's a sign that you've had a lot of sun exposure over the years, which means that you may have other skin cancers lurking around. So it's worth just getting that looked at as well.
Yeah, absolutely. Do you think, this is interesting, do you think it's sensible to get a full body check by the doctor for moles, etc.? And if so, how regularly should you do it, and from what age?
I mean, it depends on how many moles you have. Is there a family history of melanoma? How much sun exposure you've had? Have you been using sunbed? So there's lots of factors that determine whether someone should get regular skin checks. I think if you're someone who's very moly, lots of moles, then you probably want to keep an eye on your moles. And once a month, a check, maybe taking pictures on your phone and then repeating the pictures a month later and just looking for any of those changes that I talked about, ABCD. Anything looks different, go to your GP. If you've had melanomas in the past, then you'll be followed up on the NHS anyway on a regular basis. So it's a bit tricky to say without knowing what skin type you are. I mean, if you're skin type 1, which means that you burn and you never tan, and you've got lots of moles, then yes, definitely get regular skin checks. If you're skin type 3 or 4, which is sort of more Asian or darker skin types, you don't burn very often, and you do still have lots of moles, maybe you don't need it as often. So it's very dependent on your personal history and risks.
So if you're quite a moly person, does that mean you're more likely to get cancer just purely because you've got more moles to start with?
Possibly, yeah. I mean, there are some patients who have what's called dysplastic nevus syndrome, which means that they have lots of moles that are slightly abnormal. They definitely have a high risk of melanomas and skin cancers. If you have lots of moles, then there's a chance that one of them will turn at some point. So yes, you probably do have a slightly higher risk. But we also see people who don't have lots of moles and developed a melanoma without having multiple moles as well. So I think the important thing really is that you assess your own risks, how much sun exposure, family history, what skin type are you? And you can find out what skin type by looking at the Fitzpatrick skin type. You can get it online, work out what skin type are you. If you're skin type 1, 2, you have a high risk. If you have a family history, lots of moles, lots of sun exposure, sunbed use, then your risk is high. Then you should get it checked.
Okay, good. Right. Actually, I was just thinking, though, I suppose one of the things is that you feel, with the doctors at the moment, and the fact that, I think we still all feel slightly concerned going to the doctors, because they're not opening us with open arms to go into the surgeries, are they? So, and I suppose you shouldn't be put off just because that they're being like that.
No, definitely not. I think Most GPs will say they are open for business, and they are seeing patients. We definitely are in hospitals. I've just finished a skin cancer clinic just before this talk. So we're still seeing our patients in clinic. And I think the important thing is, if you pick up a skin cancer early, we can treat it early and get rid of it once and for all, particularly with melanomas. Remember, melanomas can be deadly. They can spread very quickly. They can go to your brain, your lungs. They're fatal. The earlier you pick it up, the earlier it's treated, and survival rates are very good if they're picked up early. So if you think something is abnormal, please see somebody, because the earlier we deal with it, the better it is for you, the easier it is for us to treat as well.
Yeah, absolutely. And I think also the one thing that I've really that you've brought home to me is the fact it's not just a mole. It's not just, you're not just looking for brown things, you're looking for different lumps and bumps and spots, really, isn't it?
And non-healing lesions, rapidly growing lesions, absolutely, yeah.
Yeah, because it is so often we just think, oh, it's just a mole, isn't it? So if my moles look okay, then I won't worry about anything else.
Correct.
And that's it. How do you know when a sun cream has gone out of date if it doesn't have a date on it? And also, what's the lowest sun cream factor number you would recommend?
Okay, so second bit of the question, the lowest as dermatologists we generally recommend is SPF 30.
Yeah.
So remember, SPF is a marker of protection against UVB. UVB is the burning and the reddening and the skin cancer causing radiation. UVA also can potentially cause skin cancer, but tends to cause more photoaging as well. So you want at least an SPF 30. If you're skin type 1 or 2, then 50. And you also want something with UVA protection. So UVA protection, mostly on bottles or sun cream lotions, will either say broad spectrum, which means they provide UVA protection, or they may have some sort of star rating. So you have 4 or 5 stars, and if they have a higher the star rating, the better UVA protection. So you want a good UVA protection, and you want SPF minimum 30 for skin types 2 and 50 for skin type 1, I would say. The first bit of the question with sun creams going out of date, most sun creams will have an expiry date on them. Sometimes they have this picture of a little jar with an M written next to it. So it might say 6M or 12M or 18M with a little jar, picture of a little jar on it. And that usually indicates that once you've opened it, it's valid for 6 months. If it says 6M or 18M, 18 months. So it may have that picture. So look for that picture. Beyond this, I think anything often beyond a year, and if you're not sure, then you probably just want to throw it away and get something new, because a lot of the chemicals within some creams will degrade over time. If it smells funny, or if the consistency is odd, then of course it's gone off. If it's a bit more watery than it should be, it's gone off. So there's no point in putting on something that you're not sure about, because you're putting yourself at risk of sunburning and then cancers. It's better just to get something new then.
And over the years, I've definitely noticed, because when I was younger, we had 0 rated SPFs, didn't we? And all of those things. And now it's quite hard to find anything below 30, like the lot of the big supermarkets, they don't go below 30 anymore, do they?
Yeah, you do sometimes find 15.
15, yeah.
Yeah, you do find 15. And you also will, lots of makeup products now contain sun cream, sunblocks in them as well. Some of them will provide SPF 5 or 10, but that's not enough. But the minimum really you want to be doing is SPF 30. I wouldn't go below SPF 30.
And the other thing is interesting when you were talking about, because my daily moisturizer is a 50, but I don't know if it's an A or a B or got both in.
So if it just says SPF, then it's just B.
It would just be B. So that means I'm still then allowing. So the whole point of putting the moisturizer on is to not have the wrinkles, and it's still exposing me to the wrinkles, isn't it?
Yeah, absolutely. So unless it says broad spectrum or specifically says UVA protection, then you are getting UVA penetrating through the area. And also remember, if you're working indoors next to a window, or you're driving, glass will only block UVB. It won't block A. So A will get through.
Oh my God. I work in front of a window all the time. Oh no.
The one side will be more wrinkled than the other.
Yeah.
And
I'm
we
gonna
often
go and
see it in people who drive a lot, one
Yes.
hand facing the light, and that they get more wrinkles on one side. So it's important to realize you can get UV filters that go onto glass. So you could get that as well. But so UVB is blocked by windows, not UVA.
Right. I am going to go and look at my moisturizer and see if it has UVA and B or broad spectrum.
Yeah.
So they can't say it's their anti-aging, because they all say anti-aging, unless they've got A in it. They shouldn't be promoting it, should they?
Yeah, unless they've added in other anti-aging components, which is why they're making that claim.
Right. Okay.
So if they've got like a retinol in it or some other product, then maybe they're sort of claiming it because of that.
Yes,
but yeah, from a pure sun protective point of view, yeah, it needs to be A as well as.
Well, that's a really useful tip now. Does skin cancer run in families? As both my parents have it, I check regularly. I'm very careful about sunscreen, but still concerned.
It can do, yeah. So there are, there are some genetic conditions that run in families, which means that you will have increased risk of melanomas and skin cancers, but you probably wouldn't know about those genetic conditions. If you've just got somebody in your family who has a melanoma, for example, then yes, your risk is higher. We think maybe 10, 15% higher than the general population of getting a melanoma. So it's one of the questions we often ask patients when they come into clinic: is there anybody in the family who has a melanoma? And if they say yes, then we will be a bit more vigilant, a bit more diligent in checking that patient. So I think, yes, your risk does go up if you have a family history. It may not just be genetics, though. It could also be habits. So it may be that you all went on holidays together and you all did the same sort of things, and you all did a lot of water sports, or you didn't use sun cream because, families tend to do things collectively. Or it may just be that your skin type is similar. So you've all skin type 1 with red heads and blue eyes. So your risk is high because of that. So if somebody in your family has it, then it may just be genetics, but it might be the habits within your family as well that increase that risk.
Okay. Actually, somebody's just put one up live now. What is the best time to have sun boost my vitamin D? What's the best time? I've read that really badly, and it's been written correctly. It's me trying to tell what's the best time to have sun to boost my vitamin D.
Okay. So in the UK, the guidance, the NHS guidance is that from October till March, when it's sort of more cold and wintry, everybody should be taking a vitamin D supplement to get your vitamin D levels up. Okay. We tend not to advise you purely just to go in the sun to get your vitamin D. 5 to 10 minutes of sun exposure with adequate sun protection, so with sun cream on, twice a week is probably enough to give you vitamin D levels in the summer. So there have been lots of studies now to say that sun cream does not reduce your ability to produce vitamin D. So you can still have sun cream on, it won't block out everything, you'll still get enough vitamin D production. And in the winter months, March to October, you need to take a supplement anyway. So that's the NHS guidance. You can also get fortified foods with vitamin D. So, essentially, you don't really need to go in the sun to get your vitamin D. There are other ways of getting it, because the risks generally outweigh the benefits of going in the sun. So if you're going in the sun just for vitamin D, there's a risk you'll go red, you'll tan, you'll burn, and that increases your risk of skin cancer down the line. So you're probably better off just supplementing it. And, the sun, we don't want to paint the sun as being a complete villain. There are other health benefits, of course. We know the sun helps with eczema. We know it helps with psoriasis. We know it makes you feel happier, feels better, mental health. So it's not a complete no-no. Just be careful about it. Use your sun protection. Go out in the sun carefully. Wear hats and protective agents. Don't forget your sunglasses. We see a lot of skin cancers in and around the eyes. So it's important to wear sunglasses. So I think go in the sun, but sensibly.
In fact, we had a webinar, probably this time last year, a bit late, with Dr. George McCreeve, who's a positive person for the sun, but saying exactly like you. But it's one of the one thing with it is that you can actually see the cancers if you're vigilant. It's the one cancer you can see coming. Yeah,
absolutely.
Which I think is important. But the fact is, you do have to keep looking.
Correct.
And looking for the changes. I had a non-melanoma skin cancer removed years ago and suddenly noticed a slightly odd mole. It might have been there for ages, but not sure. I'm concerned about going to my doctor as I don't want to trouble them unnecessarily. How long should I wait to see if it changes shape or grows? However, I think you probably answered that already.
Yeah, you need to go to your GP now and get it looked at. As
Yeah.
I said, if it's nothing to worry about, it'll be pretty straightforward to the GP, and they'll say, "Yeah, that's fine. You can go home."
Yeah.
If they're uncertain, they'll refer you on. If it is a cancer, the quicker you pick it up, the quicker we can deal with it and sort it out for you. It's a lot easier for you. It's a lot easier for us as dermatologists as well. So I think the best course of action is go to your GP now and get it looked at.
Definitely. And also, it just saves you worrying about it.
Yeah.
Because it's another niggle, isn't it, to worry about?
Correct.
However careful I am in employing my suncream, I always seem to miss a bit. It's amazing to see the difference between covered and not covered skin. I think we've probably all done that. You realise how powerful sun cream is when you've missed a bit, and there's a clear red line where you missed it or not. What would you recommend to put on and how to treat? I think what they're saying is when you're burnt.
Yeah. So I guess, look, the first step, of course, don't get burnt if you can prevent it. And when you're applying, don't forget the areas that I talked about, which people often miss: the top of the ears, the eyes, back of the hands, feet, etc. So cover all these areas. If you are really worried about missing areas, you can use mineral sunscreen. So remember, sunscreens are two types: chemical and mineral.
Right.
Mineral contain zinc and titanium, which are metals. And chemical ones contain a variety of different chemicals. The chemical ones usually sink into the skin, and they're usually invisible. You can't really see them. And the mineral ones, the metallic ones, form the white pasty cast on your skin. A lot of the times people don't like them because of their physical appearance. But if you do use a mineral one, you can see where it's being applied and which areas you've missed. I use that for my children because I know exactly that it's on and I know where it is. And when it comes off, I can see that it's come off. So that's what we tend to recommend for children. We also recommend it if you have sensitive skin, acne or rosacea. You're better off using a mineral sunscreen. But cosmetically, they're less acceptable than the chemical ones. So if you're really worried about missing areas and you're not too fussed about the way the sunscreen looks, then go for a mineral sunscreen. You'll be able to tell where it's being applied and which areas you missed. If you have burnt your skin in the sun, then the important thing is just use regular moisturizers. If you're blistering, you may need to see your GP or a dermatologist. You may need some topical steroids to calm down the inflammation. Your skin then will eventually peel and it will go back to normal, but you need to probably see somebody just to calm your skin down, maybe with some topical steroids. You can use things like chamomile and cooling lotions. Basic greasy moisturizers are probably the best in terms of allowing the skin to heal quicker.
And can you scar? You know, when you've burnt yourself very badly, can that leave long-term scarring? Yeah,
it can. So if you've burnt really badly, you can have scarring. You can also have significant pigmentation left behind from scarring, from burning. So yes, you can, depending on how deep or severe it is, you could potentially scar or pigment.
Just thinking about that and pigmentation, you know, when you're pregnant and then you start getting like a butterfly on your face. I remember having actually on my tummy, I think it was on my tummy that I started getting that sort of brown patches. If you're like that and then you go out into the sun, can that be a problem?
So any pigmentation that you have will get worse in the sun.
Right.
Your sun, remember, produces melanin. It increases the production of melanin in your skin, which is a protective agent. So any pigmentation you already have will get darker when you are in the sun. There's no question that will happen. So you want to make sure you're protecting yourself even more if you're pregnant, because you're already prone to pigmentation when you're pregnant because of hormonal changes, etc. So you want to be even more careful in the sun when you are pregnant.
Right. And that's the end of our questions.
Great.
So thank you. Do you feel? I mean, I just felt that was. I'm definitely going to make sure we do an article from that, because I think there were so many really great little snips of facts from that. But we'll definitely write up an article from this. But is there anything that you feel that we missed at all? Although I think we covered loads.
Yeah, I think one thing I guess I want to drum home into people listening is that most melanomas and most skin cancers are preventable. And in fact, if you go to the Cancer Research UK website, they'll say that 85% of melanomas are preventable. And it's purely down to sun exposure and your habits in the sun. So reduce your sunbed use, or in fact, stop it altogether.
Don't do that.
Don't do that. Stop it altogether. Be careful and sensible in the sun. Avoid the midday sun. Get used to wearing a hat. Wear sunglasses. Cover up appropriately. Use high factor sunblocks, and you will be able to reduce your skin cancer risk. There's not many skin cancers that you can, some will just occur and you can't do much to prevent them. But, skin cancer is one where you can prevent it, but also you can pick it up early as well. So if you see something changing, go to your GP, go to your dermatologist, get it looked at. If we pick it up early, we can treat it early, we can cure. So I think it's just be vigilant and be careful. And
obviously, and it just sort of crossed my mind, it's not, you can get skin cancer even if you're not in the sun.
You can, yes. So we also see skin cancers in darker skin types. So Asian people to my skin type, or more of our Black patients can get skin cancers. And it may not necessarily always be because of the sun. There are some genetic tendencies as well. We generally will see skin cancers more under the nails in Asian or Black patients. So they often present as a dark line within the nail, which is changed. If you get that, get it looked at by your GP. Bob Marley famously died of a melanoma in one of his nails, which had spread. He was told apparently it was all okay, but then by the time it was looked at, it had all spread, and he died quite young. In the States, I think they did a study where they looked at the common melanomas in the Latino population there, and they found that most cancers in the Latino population tended to occur on the soles of the feet. So remember that your palms and your soles, even in Asian Black people, are lighter in skin tone. So you'll get more skin cancers in these areas. So it's important to look at these areas for any moles or changing moles. So it's not just sun, and it's not just Caucasians. It can be darker skin types, and there sometimes are genetic factors that will just predispose you to skin cancers without you having any sun. So yes, sun is a major causative factor. And unless you've had other forms of radiation, so I remember when I was a trainee, I was working in an area where I would see patients who had been on the Christmas Islands, where they had been doing lots of nuclear testing many years ago, and they were coming into my clinics with lots of skin cancers from the nuclear radiation. But that's not a common thing generally. So I think on the whole, it will be sun for most people.
Okay, brilliant. Well, thank you so much again. That was really kind of you, and some brilliant facts, and hopefully we've saved some people some heartache and angst by this, for sure.
Yes, absolutely.
Thank you very much.
Thank you very much for having me.
Thank you, everyone. Cheers. Bye.
Bye.